Have you ever wondered how a behind-the-scenes process could make or break a healthcare provider's success? Welcome, listeners, to another electrifying episode of Shock Doc Medical. I'm Dr. Rod, your guide on this deep dive into the intricate world of medical innovation. And today, we're unpacking a topic that might not make headlines, but is absolutely vital to healthcare: billing, coding, and reimbursement strategies. Picture this. Every patient encounter is like a mini adventure where clinical expertise meets administrative precision. Now, what if I told you that getting these details right could mean the difference between seamless care and costly setbacks? Buckle up, because we're about to explore how every documented diagnosis and coded procedure plays a role in keeping the wheels of healthcare turning smoothly. In today's episode, we're diving into what might seem like the mundane world of medical billing and coding. But trust me, it's anything but dull. We'll break down medical billing and coding fundamentals, how patient care translates into billing claims and standardized codes, the workflow process, from the patient encounter to documentation, code assignment, claim submission, and finally, reimbursement. Reimbursement models. We'll explore the complexities of private insurance, managed care plans, government programs like Medicare and Medicaid, and even the challenges of self-pay. Coding systems, an in-depth look at ICD-10, CPT, and HCPCS codes, and how these universal languages streamline communication across the healthcare system. Revenue cycle management, best practices for ensuring accuracy, timeliness, and efficiency, from automation to effective collections. This episode is a must-listen for anyone curious about what really happens behind the scenes after you visit your doctor and how these processes safeguard both patient care and provider viability. Let's start with the basics: medical billing and coding. Imagine you just had a doctor's appointment. During that visit, detailed clinical information is gathered, everything from your symptoms to the procedures performed. This is where medical billing steps in. It's the process of translating those care services into billing claims. Think of it as converting your health story into a language that insurance companies and government programs understand. Without this, healthcare providers wouldn't be reimbursed for the services they deliver. Now, what about medical coding? This is where every diagnosis, procedure, and treatment gets assigned a standardized code. It's like having a universal shorthand that ensures every detail of your visit is accurately communicated, whether it's to another provider or a payer. By using these codes, we eliminate confusion and make sure that everyone, from hospitals to insurance companies, is on the same page. The workflow process is equally fascinating. Patient encounter. It all starts when clinical information is gathered during your visit. Documentation. Providers carefully document diagnoses, treatments, and procedures. Code assignment. Professional coders then translate these notes into specific standardized codes. Claim submission. Billing staff prepare and submit these claims. Reimbursement. Finally, payers process the claims and reimburse the practice according to predetermined fee schedules. Each step is critical in ensuring that claims are accurate, timely, and compliant with regulations, ultimately reducing denials and preventing revenue loss. So next time you see a bill, you'll know there's a complex yet beautifully orchestrated system behind it. Now let's bring it closer to home. Consider the story of a small clinic that managed to drastically cut down on claim denials simply by refining their coding practices. By ensuring every detail was documented and coded correctly, they not only increased their reimbursement rates, but also enhanced patient satisfaction by streamlining their billing process. Imagine the relief of patients who receive clear, compassionate communication about their billing, combined with flexible payment plans that make healthcare accessible to everyone, even those on a tight budget. Think about the ripple effect. When healthcare providers are reimbursed accurately, they can invest more in patient care, adopt innovative technologies like advanced billing software and electronic health records EHR systems, and ultimately provide better service to all of us. Let's chat for a moment. What if this breakthrough in understanding billing and coding could revolutionize how healthcare is delivered? I've had conversations with numerous experts who insist that streamlined billing processes not only prevent revenue loss, but also significantly enhance operational efficiency. One expert recently mentioned that automation in claims processing is like having a digital assistant that never sleeps. And isn't that the dream? These insights aren't just theoretical. They're backed by rigorous practices observed in successful healthcare setups nationwide. When we look at reimbursement models, the picture becomes even more dynamic. Private insurance. Most patients are covered by private insurers that negotiate rates and require detailed documentation. Managed care plans. Networks like HMOs and PPOs have strict guidelines that providers must adhere to. Government programs. Medicare provides standardized fee schedules for individuals 65 and older. Medicaid, on the other hand, offers varying rates and rules across different states. Self-pay. For uninsured patients or those opting to pay out of pocket, providers often offer discounts or flexible payment plans to ease the burden. By understanding these models, providers can tailor their strategies to meet regulatory demands while keeping patient care at the forefront. Let's demystify the coding systems that keep this entire machine running. ICD-10, International Classification of Diseases, 10th revision, used to classify and code diagnoses, symptoms, and procedures. ICD-10 is crucial for documenting patient conditions accurately. It's not just a set of numbers. It's a framework that supports epidemiological research and clinical decision-making. CPT, current procedural terminology, maintained by the American Medical Association, CPT codes describe the services and procedures provided by healthcare professionals. These codes ensure consistency and accuracy in billing across different payers. HCPCS, Healthcare Common Procedure Coding System, complementing the CPT, HCPCS codes cover items like durable medical equipment, prosthetics, and ambulance services. They ensure that even the services not captured by CPT codes are billed correctly. Each of these systems plays a pivotal role in the larger narrative of medical billing, ensuring that every aspect of patient care is recorded and reimbursed appropriately. Now let's zoom in on revenue cycle management. This is where the rubber meets the road. Claims processing. The goal is to achieve accuracy and completeness. Ensuring that claims are complete and correctly coded minimizes denials and delays. Timeliness is key. Submitting claims promptly and following up on unpaid ones can significantly improve cash flow. Automation and technology, leveraging modern billing software and EHR systems, can reduce manual errors and streamline the entire process. It's like moving from a typewriter to a smartphone. Efficiency skyrockets. Collections. Clear, compassionate communication about billing policies can make a huge difference. By offering flexible payment options and regular audits, providers can maintain robust collections while ensuring patient satisfaction. These best practices aren't just theoretical. They're proven strategies that have transformed the financial health of practices across the country. As we wrap up today's exploration of medical billing, coding, and reimbursement strategies, I hope you've gained a fresh perspective on a critical aspect of healthcare that often goes unnoticed. From the precision of coding systems to the intricacies of reimbursement models and the importance of efficient revenue cycle management, every detail matters. I invite you to join the conversation. Share your thoughts, questions, or personal experiences with billing and coding in the comments. Don't forget to like, subscribe, and spread the word. Remember, staying informed about these innovations is key to understanding the future of healthcare. And here's a little teaser. Next week, we'll uncover another groundbreaking discovery that might just change everything in patient care. Until then, keep questioning, keep learning, and as always, stay curious.